Well, you've heard testimony of the impact of abortion on women, on the African American community. But is there scientific evidence that abortion hurts women? We're going to hear now from Dr. Martha Shuping, practices psychiatry in Winston-Salem, North Carolina, has more than 2 decades of experience in helping people with abortion recovery issues. Dr. Shuping is a co-author of published research on abortion and women's mental health. She's a co-author of a self-help book, The 4 Steps of Healing. She has presented workshops on abortion and women's health issues at the United Nations and has traveled internationally to teach professionals and peer counselors about the effects of abortion and how to facilitate recovery. Dr. Shuping will address scientific evidence that abortion does hurt women.
I wanted to start out by telling all of you that I do have some history on both sides of the abortion issue. In 1973, when Roe became the law, I was a university undergraduate, and I was one of those counselors. I was trained in one evening to help women make this abortion decision. I was taught that there are no side effects of abortion. It's the only surgical procedure in the world with no side effects. And I was taught the clump of cells theory, and that's what I told women. So it's not surprising to me, knowing the quality of care that I was knowing the training I received and what I provided for women, it's not surprising to me to see today that there is research showing in one large study only 10.8% of American women believed that they had adequate counseling before their abortion, and 2/3 of the women said they had no counseling. And that makes sense with my own experience. But since the 1980s, I've been helping women to deal with their abortion-related mental health problems. So we're going to try to look at some of the scientific evidence. I would urge you to read the rest of the slides after the conference because they will be made available, and we won't have time to go through everything. But, sorry, it's, okay, good, it shows. This is an abortion provider's textbook. It was written by abortion providers for abortion providers to teach people how to do abortions. In this book, it says that some women do have negative reactions after abortion. They concede this. And they said some women who started out having mental health problems beforehand are more at risk for having problems later. But they also say that some women who didn't have problems to start with also end up with problems after abortion. So that's a starting point. They list several kinds of negative reactions: depression, guilt, shame, regret, and grief. Depression can include, according to the textbook, crying frequently, suicidal thoughts, performing poorly at work or school, losing interest in enjoyable activities, feeling worthless. They explain guilt and list some of the aspects of guilt, which can include self-punishing behaviors such as substance abuse, which we heard about earlier today, relationships with abusive partners. 3 symptoms of guilt that they list also happen to be symptoms of post-traumatic stress disorder, nightmares about babies, which we heard about today, blocking out the experience, avoiding anything that triggers memories of the event. Shame can include engaging in self-destructive behaviors, having relentless thoughts of being a bad person, regret, dwelling on the negative consequences, unresolved grief that keeps you from moving forward. So, they know that some women have negative reactions. They also know, the textbook says, who is more at risk for having negative reactions. And there are many categories. I didn't put all of them here, just some to give you an example. But if you had an existing mental illness to start with, you're more at risk. Significant ambivalence about the abortion decision. That would mean maybe you have difficulty making the decision, some distress about it. You're not sure which way to go. Those women are more at risk. Perceived coercion to have the abortion. Notice perceived. That means it's not whether your mother thinks you were being coerced or somebody else. Did you feel you were being coerced? It's in the eyes of the beholder and what your experience was. Those women are more at risk. Commitment to the pregnancy. I was shocked to see that. Women who are committed to the pregnancy intend to carry their pregnancy, and yet they have abortions. Those women are more at risk for negative outcomes. And past childhood sexual abuse. That includes a lot of women. There's some estimates 15 to 25% of American women have been sexually abused. Those women are more at risk for having problems after an abortion. So we call these risk factors because the women are more at risk. Now, as I say, there were additional factors, but those are just kind of some examples. Now, researchers on both sides agree that these things are risk factors. That's important to understand. Nobody's disputing these at all among the research community. Not only the clinician's guide, but 31 different studies for prior psychiatric illness as a risk factor. So why aren't women being screened and warned about pre-existing mental illness being a risk factor? Why aren't they told? Researchers from both sides agree ambivalence is a risk factor. Not only the textbook, 21 studies to date. Researchers from both sides agree coercion is a bad thing for women, leads to bad outcomes. Not only Clinicians' Guide, but 9 studies and the American Medical Association. Women from both sides agree if you're committed to the pregnancy, you're going to be more at risk for those negative outcomes. Clinicians' Guide and 7 studies to date. And again, researchers from both sides with regarding past childhood sexual abuse or unresolved trauma, at least 5 published reports, the textbook, and a second abortion textbook where I was able to find a reference. And it's a very authoritative textbook. So again, researchers from both sides agree. This one was not listed in the Clinician's Guide, but there's at least 15 studies and wide consensus on both sides. If you're an adolescent or young adult, you are more at risk for having problems after your abortion. Now, one other risk factor, I mentioned earlier, studies have shown 2/3 of women reported no counseling whatsoever, 10.8% with inadequate counseling, and there are a total of 10 studies now that are showing inadequate counseling or poor abortion care is also a risk factor for not doing well afterwards, not surprisingly. So, everybody agrees some women have problems after abortion. Researchers on both sides agree on many of the types of symptoms that can occur after abortion, agree on which women are most at risk due to pre-abortion conditions, but disagree on how many women are impacted and disagree on how much information women should have when they're making their decision. Women are being pressured and coerced. In one study of a general gynecology population, again, this was not people who had problems, this was just a general gynecology population, 64% of the post-abortion women said that they reported feeling pressured to abort. And then in a study of women who had problems, who were dissatisfied with their abortion, 73% reported pressure from others. Again, women have abortions even though they are committed to the pregnancy. 17.7% of post-abortion women in a general gynecology population stated that pregnancy was desired even though an abortion was performed. So, 55 million abortions since 1973. Maybe 9.7 million desired pregnancies ended in abortion since Roe. We don't know the exact number, but certainly there's data to suggest the number is not small. And let me just say, one of the reasons that you can read in the slides later that we won't get to is that many women bond to their baby before the abortion. Women start bonding to their baby at an early age, and even though they are told there are no side effects, there is no downside, it's not a baby, afterwards their hearts are breaking because they had bonded to their baby and they missed their baby. And research actually shows that is a risk factor. If you have bonded to your baby, that is a risk factor for not doing well. There was an Australian study that found that 40% of women at an abortion clinic had talked to their baby before the abortion. If they're talking to their baby, they're not thinking clump of tissue. Okay, so the American Psychological Association gave their spin on what happens to women after abortion in a 2008 report, and I want to make sure people really understand what it says in the depths of the report. This was a 107-page report, and it identifies several subgroups of women who are at increased risk of having mental health problems after abortion. They identified 18 risk factors. Now, we looked at a few of them already, and most of those are ones that the APA will bring out. But there are 18 of them, and we can't see all of them here. But that admission was downplayed in their report. So now we're going to see 7 of these risk factors. And most of these, you heard me say already, that other researchers have found these things also. Women who are coerced or pressured, women who are committed to the pregnancy, women who are terminating a pregnancy that is wanted or meaningful, women with prior mental health problems, women who have ambivalence about the abortion decision, young women under 21, and women who have already had 1 or more abortions. These women are more at risk for having problems later, and the APA report acknowledges that. So they explain basically in the report that when they're saying women don't have problems, they're not talking about these women. They're not talking about women with these 18 different problems, because we know that these are women who do have problems. So, in their conclusion, what they state in their press release, there is no credible evidence that a single elective abortion of an unwanted pregnancy in and of itself causes mental health problems for adult women. So look what they're saying very carefully. It's almost a shell game here. The APA report said very precisely they were talking about adult women because they already know that 25% of U.S. abortions are performed on teens, and teens, everyone agrees, all the researchers know, that teens are at increased risk for mental health problems, as we've already looked at. So they're also talking about women who have a single abortion. They're not talking about women like Cindy Collins or Rebecca Porter who had multiple abortions, because the data shows that women who have had multiple abortions, they are more at risk for having bad reactions. And the research shows that all the researchers on both sides agree, but 50% of the women having abortions are in that category. So that's a huge segment of women who are having problems, and the APA said so. So, again, just to recap, in their conclusion, they're clearly talking about women who are having an abortion of an unwanted pregnancy, though we've already seen that perhaps 10 million women had abortions of wanted, desired babies. And they concede in their report, terminating a pregnancy that is wanted or meaningful, that puts women at increased risk. We've seen there's 18 risk factors, so we're not talking about those women, and the no problem conclusion doesn't apply to them. So basically, we're seeing that the conclusion that they came up with, that they put forth in their press release, does not apply to the majority of women having abortions in the United States. Now, the next thing, though, they've excluded the majority of women, but they also excluded a lot of the world literature on abortion. I'm sorry, how many minutes? Oh, my time is up. Okay, let me just say, the abortion doctors did a study on post-traumatic stress disorder, and they were worried about it, but the APA didn't want to talk about it. So I hope that you'll read the rest of the PowerPoint because there's a lot there. Thank you.